I received this topic, I felt same is like Ukraine. Game is lost. But when I see the trend, Ukraine gave a good fight, right? And my opponents, this very well presentation has done my work very easy. So we will go ahead. Absolutely, my answer is definitely no. Sir has already highlighted this point. So my disclaimer: AI has been used to prepare these my slides, right? That it will time take, right? So you will feel like क्या हो रहा है, but you will understand later on. So this is not our personal fight. We are very good friends, and let's understand what's the topic. Actually, my friend has explained about the cars, mobiles, lifestyle, aviation. Actually, this topic is about the diabetes. It's not about the AI is good or bad. AI is excellently good, but it is about the are we ready to use AI to get algorithm-based decisions which are made on AI-based algorithms. Right, so we should understand this topic. This is not against AI or in favor of AI. This is already based on only on algorithm, right? So my friend is very much differed on the topic itself. First challenge, as sir said, data availability. So if, where AI gets data, when we ask any question to data, where AI gets. So all AI data is getting from the health records. All over the health records generated by the patients, doctors, hospitals from tier 1 to tier 3 cities. So let's see the what is the current health data, digital data of our India. So this is the last year data. Only 35% of Indian doctors are using EMR. What we said, only 35, 1/3%. Right, and in this 35%, mainly comprising of the corporate hospitals, tier 1 city doctors. What we are practicing is a EMR. But when you go to the some just out of the Ahmedabad or in Ahmedabad, many general practitioner physicians still they are using handwritten prescription. This data is not anywhere going to the AI, and this is not going to useful to take any further decision. Right. So this is the first challenge: digital health records. Second, our prescriptions. It is already we know how our handwriting is. This is a real prescription. This is not I have made, and this is a real prescription of the some state, and some also DGCA has some raised query for this. When I put this prescription on our Chat GPT, even Chat GPT can't read this prescription. I think only pharmacist will be able to do this. So how AI will get data from these prescriptions? Challenge to data quality and bias. So second, from where AI gets this data? From our questions and their answers. So when we raise question of same question repeated time, every time it will change and refine its answer depending upon our further questions. So it also generate biases. So AI algorithms can amplify existing biases in training also, which could lead to unfair or inaccurate diagnosis and treatment recommendation for some patients. So all our risk also increases when you get answers from the AI. Let's take live questions. We don't discuss theory. Let's see the case of 13 HbA1c. Just last month my patient, FBS 387, PPBS 448. Many doctors will prescribe insulin. Some may be OHA. This is not a question. What our currently widely used AI are answering on this question. First, easily available, that is Meta AI on our WhatsApp. In our WhatsApp, first line is Meta AI. If you type anything and then send button, it will answer. So in this case, Meta AI has answered that first 4 weeks you just do patient education, dietary counseling, physical activity, and weight management. No medications. This is the answer from our Meta. I widely used our social media applications, what Dr. Nimmi has said. Right? After 5 weeks, you start the pharmacotherapy. Till this 4 weeks, patient might have gone to another doctor. Right? Another AI, ChatGPT, one of the most widely still used. In this the ChatGPT, I have same copy pasted this question. New type 2 DM, 13 HbA1c. Everything is clearly defined here. Weight is defined, current sugars, HbA1c, new DM, and please provide treatment algorithm. I have asked the same question. We are asking about the algorithm. This ChatGPT has identified everything as in differentiation. Age is there, weight is there, diagnosis, FBS, PBS. That's fine. Stage 1 initial, that's good. Then stage 2, they said only basal bolus treatment. So now how many of our doctors in this 13 HbA1c will start only basal bolus as therapy? Please raise your hands. In type 2 DM, this weight, basal bolus therapy, how many of your doctors would have the first choice? Right? No one will start with basal. Some may be premix, some may be basal, some may be oral, right? And after basal bolus, they stated that when sugar goes below 300, and as you see in step 3, then you start metformin, only with 500. So still, this is the ChatGPT still most widely used AI in all over the world, right? It cannot answer a simple question of new type 2 DM patient. If any physician or general practitioner if relies on this patient might obviously go to another doctor, right? Third, perplexity. Now many doctors were saying that perplexity is a good platform for medical doctors. I have asked the same questions. It is again demonstrated basal bolus, and then again all lifestyle, diet modification, and then same days after sugar goes to less than 250, then you can start to oral metformin and blah blah blah, all other medicines on the second step. And many add SGLT inhibitor. In this 13 HbA1c and 400 sugar, we will not add SGLT obviously. So AI cannot answer our any diabetic scenario you put. AI will not answer perfectly what we are doing currently. So AI can't replace our clinical judgments at any point of level. Challenge 3, lack of transparency and trust. So as you see in the last case, we cannot trust AI completely. If we have put some question, AI gets answer and we just follow this answer. Every time we will have some question, we'll modify its answer, we'll modify its therapy. So because of its complex nature, we can't get every answer perfect from the AI. There is another bigger challenge of privacy and security, because lots of patient data are going online. Patients' private data, including mobile numbers, their addresses, their current sugars, their comorbidities. It may be use of some pharma persons, maybe many companies. As we see, all the apps are there. So maybe they are utilizing this data for their professional purpose. So obviously, privacy and security purpose is there. Problem is also there. Challenge 5, regulatory hurdles. This is the most important problem is currently AI, because AI is a dynamic feature, it is not a static. So if you format a regulation, AI will change its mode. You can't regulate every model of AI, and particularly ML based devices. This is a challenge 6, we can say most problematic challenge, accountability. Determining responsibility of errors or adverse events from the AI-driven decisions or medical devices remains a critical legal and ethical concern. Clear lines of accountability needs to be established. It is not there at any level of AI or any mode of AI. There is, for our doctors, there is a negligence act, medical negligence. There is a civil law, criminal law. There is a defined protocol. Start from the initiation to summons to pleadings to trial, to appeal from the lower court to high court to Supreme Court. Everything is defined for our doctors. If anything decision goes wrong, it is our doctors committee sets in, they decide either it is good or bad, it was in a negligence, either it was a degree correct or not. But for AI, if AI has some done mistake, if you take some AI decision in your treatment, leads to adverse events or even death of the patients, then who would you put behind the bars? Doctor or any AI? Right? This is the biggest problem currently we have. Challenge 7, ethical considerations. Issues surrounding the patient autonomy, data privacy, security and accountability. All this leads to some ethical consideration for patients. And also, as Sir says, accessibility and affordability. Many peripheral our states, many peripheral gaons, they don't have even network connection. So how will you use AI in these patients? They don't have a smartphone. They don't have that level of education that they can use this AI. Even EMR prescription, that is a far ahead. So this challenge comes 8. Are we completely depend on AI? Can we use all AI answers directly straightforwardly? No. Even patients will not trust this AI answers. They will see at you, okay, what doctor you are saying, AI answer is different. So even our doctors or patients can't trust AI 100%. Education and training, the health professionals are also need to be so much educated about how to use AI, its health, its benefits, its limitations, its adverse events. Even doctors don't know about either to go for straightforward answer decision making or have to modify or not. So we can't completely rely on AI. And the last but not the least, AI can't provide any human empathy. When patients come aside, આપણી પાસે બેસે અને આપણે કહીએ જે સારું થઈ જશે, 400 શુગર લઈને આવ્યું હોય, સ્ટ્રેસ લઈને આવ્યું હોય કે હવે શું થશે અને જસ્ટ યુ સે કે બહુ જ સરસ થઈ જશે, એ વસ્તુ ક્યારેય AI એમ્પાથી, હ્યુમન એમ્પાથી કેન નોટ પ્રોવાઈડ ધીસ. So my take home message is AI is a really wonderful. I am extremely techy person. I am very much using AI. It's still very much wonderful, but it's not the right time to use algorithm based decision for diabetes. We are not talking about the luxury lifestyle mobile, we are not talking about the social media, we are not talking about the Zomato. We are discussing about the very serious thing, that is the diabetes management. So for me currently algorithm based decision cannot be used for diabetes management. Maybe after 1 year, 2 year, 5 year, 10 year, I don't know, but right now it is not the time, because all AI are currently in a developing phase.
Since both have put their views, every coin have two sides, and both have completed before time, I think 1 more minute to Nimmi. Rikin, stay here only. You also will be given the time.
AI blade थोड़ी છે તારી પાસે. In my PPT, did it ever say that AI is here to replace me or you, all of us? No, AI is here to enhance and help our patient's needs. If my patient has to wait 24 hours, રાતના 8 વાગે પેશન્ટ મને મેસેજ કરે કે મેડમ કેરી ખવાય, અને હું એનો જવાબ બીજા દિવસે 11 વાગે આપું કે હા ખવાય, એની જગ્યા ઉપર મારું AI chatbot એને within fraction of seconds જવાબ આપી શકે, yes, in moderation, mango can be consumed. That's all. Second, જે એનું હતું કે ડિસિઝન મેકિંગ ઇઝ સ્ટીલ મી. એનું CGM એને ડિસિઝન નથી આપતું, એનું CGM એને ડેટા આપે છે. એ ડેટા જે એના પેશન્ટનો છે, એ ડેટાની માલિકી એનું પેશન્ટ છે, અને એના ડેટા ઉપરથી એ વધારે સારું ડિસિઝન મેકિંગ કરી શકે છે. ઇફ ધેટ પેશન્ટ whose HbA1c is 13, if I put freestyle liberato plus and if I achieve better results in 3 months, yes, it's a benefit to my patient, because we all know early sugar control means less microvascular, macrovascular complications. So first, decision maker is me, ethical and legal responsibility is mine. AI is not replacing me, my algorithm is not me. મારા પેશન્ટને તો હું જ કહીશ કે ભાઈ તારું શુગર તો મારાથી આમ થઈ જશે, જે આપણે બધા જ કહીએ છીએ. What do you think? Bansi sir will not be telling, "Arre, you have come to correct place, sir. Only I can do that." Right, na sir? We all say that. Correct. Decision maker is still doctor. Responsibility is still doctors, not the chatbot. Chatbot is there to help me save my time and guide my patient. That's first, right? It's not a replacement for human brain. I must tell you, it's a child of a human brain. Data privacy, yes, I know breach of data is a big issue that happens through WhatsApp, that happens through calls. How many spam calls we receive in a day? We all do. So the solution is not to delay the AI integration. Solution is stronger regulation. One, wheel માથી હવા જાય તો એ પૈડું ના બદલાવાય, એમાં ખાલી હવા જ ભરાવાય. આ એવી જ વાત કરી કે આખી ગાડી બદલી નાખો. ઓફલાઈન એપ, સર તમારી વાત બિલકુલ સાચી છે. એવી રૂરલ જગ્યા કે જ્યાં ઇન્સ્યુલિન વિશે કદાચ માહિતી પણ નથી પહોંચતી, ત્યાં સર આપણું AI ચેટબોટ જે તમે ગાઈડ કરેલું છે, તમે પ્રોમ્પ્ટ્સ મૂકેલા છે, એ તમારા પેશન્ટને સારી રીતે ઇન્સ્યુલિન લેતા શીખવાડી શકે. હવે એવા પ્લેટફોર્મ્સ પણ છે લાઇફસ્ટાઇલ મોડિફિકેશનના. આઈ યુઝ ટેપ હેલ્થ ઇન માય ફોન. ટેપ હેલ્થ કરીને એપ મને ડીટેકેજ આપી છે, where I click a photo of my food. I'll give you, I have a free subscription for 1 year I can give. So it can give me correct ideal proportion size, which has helped me lose weight. Again, દર વખતે એનું ઓનલાઈન ઇન્ટિગ્રેશન જરૂરી નથી. There are integrated offline apps also. So we have to look for solution, not worry the decision making. And yes, I absolutely agree with my opponent that we are not there yet. But it does not mean that we are not ready yet.
Last count.
Quick, Rikin, very quick.
I think they are operating in only two things. One in the CGM. Still CGM is costing around 5 to 6,000. So it's a limited users, right? And the second issue, she has not counter about the insulin pump. I am in support of her. Insulin pump is there, but in India, only less than 5% of type 1 diabetes are using insulin pump. And type 1 diabetes population is 5 to 10% from all the diabetes populations. So, and last, she said about all the chatbot is, if anything erroneous reply has done to patient by the chatbot, or any or your platform, and if patient has take some decision from that, and if adverse event goes on, who will be the responsible, chatbot or your doctor who is developed this chatbot?
That guideline is clear.
So, thank you. So, it's just a view of both sides of the coin. The both speaker did well. Actually, I think it is not artificial intelligence, it's the augmented intelligence, and probably it is in evolution. So both are right in current times, but as the time will progress, probably it is going to become more refined and maybe more useful. It's just like a driverless car. The same kind of things which we can discuss here. Thank you. So we close the session.
Sir, worded.
Huh?
He's waiting.
Tie, sir, tie kariye.
Tie, both. both.
I think AI is good for the practice, but current scenario, at each every place it is not useful. Both are useful, but AI is more useful in near future. So AI is necessary to implement, and it is necessary for all the doctors who are going to be a good practice.
Actually, today most of the patients are coming with plenty of knowledge regarding their complaints, disease, and the treatment also. They also know what are the side effects of the medicine and what will be happen in future after a few years. So actually, we also should be remain prepared for that. We are supposed to explain them which site is better for them or not, which is authentic or not. And actually, we have to coordinate medical science, exactly what is their database, according to what is the protocols are given to us, according to the study, what have been done. And then we can explain what should be used and what should be followed in which way. So I think this will be the better way for us. And of course, your empathy is, I always believe in that. We are supposed to give the time to the patient and counsel the patient regarding the disease itself. Because what data we receive from the, Western countries or other than, and our genes are different, our diet is different, our culture is different. So now I always say that Dr. Bansi Sahu that we are supposed to prepare our data now. Now there are so many patients we are receiving of diabetes, plenty of, I think rather maximum in the world. So we can make our data and we can use that data for the patients according to our cultures. Thank you.
So both are doing well. If audience have other view, they can.
Nimmi photo I want to catch.
So,